So to continue, as I was talking about the causes of what causes hyperviscosity of the blood, I mentioned that this depends on let us see what is the components of this fluid. The components of this two-phase liquid or fluid, which is not a simple fluid, which is the blood, are the cellular elements and this fluid, which we call it the plasma. And the plasma, as I mentioned, is an aqueous solution containing proteins, containing molecules, containing salts. And the most important in the plasma, controlling the viscosity of the plasma and so controlling the viscosity of the whole blood, are the fibrinogen and also the plasma, the proteins, including the alpha globulin, alpha 1 globulin, alpha 2 globulin, beta globulin, and the gamma globulins. That's why all conditions associated with clinical conditions associated with increase in the plasma protein, especially hyperglobulinemias, or hyperfibrinogenemia or dysfibrinogenemia, they will cause hyperviscosity. And among these important clinical problems associated with or causing increase in the plasma globulins, we have conditions associated with what we call monoclonal gammopathies, and we have also polyclonal gammopathies. The monoclonal gammopathies include the multiple myeloma, of course. That's why multiple myeloma is one of the important causes of hyperviscosity syndrome. And it is the most common plasma cell dyscrasia or monoclonal gammopathies. Number one, multiple myeloma, especially IgA myeloma, also the light chain myeloma, also the IgG type 3 myeloma, and the IgD myeloma. These subtypes of multiple myeloma, they are associated with hyperviscosity because there is increase in the globulins, there is hypergamma globulinemia. Also in Waldenstrom macroglobulinemia, also in monoclonal gammopathies of unknown significance, which is a type of monoclonal gammopathies, also in heavy chain disease. Also sometimes in isolated plasmacytomas. These are all might be considered in the differential diagnosis of monoclonal gammopathies with hyperviscosity syndrome. Also, other conditions associated with what we call polyclonal gammopathies, including the connective collagen vascular diseases, connective tissue diseases, including rheumatoid disease, including systemic lupus, Sjogren syndrome, the mixed connective tissue disease, the connective tissue overlap syndromes, combining rheumatoid with lupus, Sjogren disease, all these collagen vascular disorders are associated with polyclonal hyperglobulinemias or polyclonal gammopathies. Also in patients with cryoglobulinemias, with its subtypes, cryoglobulinemia type 1 and the cryoglobulinemia type 2, they are associated with polyclonal gammopathy and hyperviscosity syndrome. So there might be hyperviscosity in patients with rheumatoid, systemic lupus, Sjogren, cryoglobulemic syndromes is one of the causes of hyperviscosity. We should consider in the differential diagnosis when we search for the underlying cause of hyperviscosity. Also, some of the infections like HIV is one of the causes of hyperglobulinemia and hyperviscosity. We should not forget the COVID-19, which is responsible for our problems in the current era, the pandemic. COVID-19 associated hyperviscosity also described in some patients with COVID-19 as a complication, as a hematological complication of COVID-19. So this COVID-19 hyperviscosity, HIV-related hyperviscosity, this is through increase in the globulins in the blood. This is the mechanism. So they increase the plasma viscosity, so they increase the whole blood viscosity. So this is the globulinemic states associated with hyperviscosity. Also, hyperproliferative conditions including leukemias, lymphomas, myelomas, thrombocytosis, all chronic myeloid leukemia, polycythemia rubra vera, that's all myeloproliferative disorders. They are here associated with increase in the cellular components, whether the white blood cells alone plus or minus other blood cells, that is the increase will affect all the hemopoietic series arising from the bone marrow, the erythroid, the leukoid or the leukocyte series, and the megakaryocytes with the mother cell of the platelets, as we all know. So all hyperproliferative and myeloproliferative conditions, they are associated with hyperviscosity. So here, cellular components, plasma proteins, globulins, fibrinogen, dysfibrinogenemia, hyperfibrinogenemia, these are all causes. And then we come to the third mechanism, which is diseases associated with loss of erythrocyte deformability or decreased erythrocyte deformability, including sickle cell is the most common, and the sickle cell disease and sickle cell states with its spectrum is associated with loss of RBC deformability. The RBC become less deformable and the blood will become more viscous, because as I mentioned that lost RBC or lost erythrocyte deformability, here the deformation rate, which I talked about when I was talking about the non-Newtonian rheology characters of the whole blood, the non-Newtonian rheology of the whole blood, which varies with the deformation rate and with the yield stress and with the viscoelasticity and the factors which determine the non-Newtonian rheology in general. So the deformability is a very important, as I mentioned, is a very important. The erythrocyte deformability is a very important factor of affecting blood viscosity, and any disease which decreases the deformability of the erythrocytes or the red blood cell, it will cause hyperviscosity, and this is exemplified by the sickle cell disease or sickle cell states in general, and also in hereditary spherocytosis, which is another type of hereditary anemia. And also in some other hemoglobinopathies, including, for example, the thalassemia sickle cell or the sickle cell hemoglobin C disease, which is a mixed forms of abnormal hemoglobins inside the erythrocytes, and we all know these are among the types of hereditary anemias, whether the hereditary spherocytosis, stomatocytosis, sickle cell disease with sickle cell hemoglobin, hemoglobinopathies like thalassemias, etc. So any form of such diseases might be associated with hyperviscosity, and this is the basis of the occlusive crisis, which happens, for example, in the sickle cell disease or in the sickle cell overlapping with other hemoglobinopathies, as we all know. So this is the diseases affecting erythrocyte deformability and causing hyperviscosity. Also diseases which increase the hematocrit, as I mentioned, that's the number and the volume of erythrocytes, like in all conditions associated with erythrocytosis and polycythemias. Including the primary polycythemia, that's polycythemia rubra vera, and secondary polycythemia, most commonly complicating cyanotic congenital heart disease. So children with cyanotic congenital heart disease, they are liable to have hyperviscosity, they are liable to have hyperviscosity syndrome, and this is very important in clinical practice. These are the conditions which might, or diseases which are associated with the hyperviscosity and cause the hyperviscosity syndrome with its all complications, which we see in clinical practice. Then I will talk about what are the clinical presentation or the clinical manifestations of hyperviscosity syndromes, or when we start to suspect that this patient has hyperviscosity with one of its underlying diseases or one of its causes. And here let me start to talk about the clinical presentation of hyperviscosity syndrome, the clinical presentation of hyperviscosity syndrome.